Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Here we're going to look at the perinatal mortality rate. So as per the perinatal mortality rate, the term, it includes both the late fetal death as well as the early neonatal death. So late plus the early. So late, by late we mean the late fetal death, and the early means the early neonatal death. Next, moving on, the babies are chosen for inclusion in perinatal statistics should be above a minimum weight. So the above the minimum weight, that is 1 kg or 100 grams, 1000 grams. So the birth weight is not available, a gestation period of at least 28 weeks. So at least 28 weeks should be used. This is as the weight of 28 weeks corresponds to the 1000 gram. Next, if both are unavailable, they are crown. If both are not available, then crown to heel length of at least 35 centimeters should be used. So then you use crown heel length. So crown heel length of at least 35 centimeters is something which is used. So then moving on, generally the PMR is equal to, so what is the formula? By formula, the PMR is equal to the late fetal death. So it is a late fetal death. It is a late fetal death and the early neonatal death. So as we discussed earlier, there is a late fetal death plus the early neonatal death, and this is this will be multiplied by 1000. So again into 1000, and it will be divided by the total birth. So it will be divided by the total birth. So this is total birth over 1000 kg. So as we discussed, it's 1000 grams, and this is at the 1000 gram who weigh more than this is 1000 gram at birth. Next is, moving on, the PMR is a yardstick of obstetric and pediatric care, that is, it's very important, and around the time of birth, pediatric care before and around the time of birth. The PMR in India, the perinatal mortality rate, if you look at the statistics, it is going to be around 24. So it is 24 about 1000 births. Next is the main cause of the perinatal mortality are intrauterine and the birth asphyxia. So it is going to be IU as well as the that is intrauterine as well as the birth asphyxia. Next is it can be intrauterine, birth asphyxia, low birth weight, birth trauma, as well as neonatal infections. Next is the actual perinatal period. It commences from the 22 weeks of life. So when you look at the perinatal period, it will commence from the 22nd week of life, but at the same time the fetus weighs only 500 grams. So if you look at the fetus, it weighs only 500 grams. Next is, moving on, so to repeat, the actual perinatal period, it commences from 22nd week of life, but at the time of the fetus weighs only 500 grams. So in case of statistic calculations and international comparisons, to calculate the perinatal mortality rate, the period from the 28th week. That is the reason why the 28th week is taken. And the kg is considered as 1 kg or 1000 grams. So as per the statistics, it is 1000 grams which is being taken. To learn and grow daily like this, please do subscribe.